Receptors as drug target.これやったか。Roots of drug administration. Okay. The wonders of medicine. Unit 2. Roots of drug administration. Small intestine, large intestine, liver, esophagus, heart, lung, trachea, tongue, stomach. For pharmaceutical agent to be effective in carrying out its selective action, the drug must be administered in an appropriate manner. Each route of drug administration has specific purpose, advantages, and disadvantages. Oral route. With this method, drugs formulated in liquid or solid form are absorbed into the body from the gastrointestinal tract (GIT). This is the most commonly used route. Oral drugs are convenient, portable, painless, easy to take. Also, administration can be carried out by the patient him or herself. However, the onset of the drug's effect is relatively slow. Sublingual route. In this case, the drug, usually in tablet form, is placed under the tongue. This produces a very fast onset of drug action. Because of the good blood supply to this area, but the duration of the drug's effect is usually short. Rectal route. This method can be used for patients who are unable to take drug orally, or with younger children, elderly, or mentally disturbed patients. This route is useful when the drug is unknown to cause GIT irritation. However, absorption is often incomplete and effectiveness is unpredictable. Injection routes, subcutaneous route, SC. There are few blood vessels in the fatty tissue just below the dermis, so absorption is slow but usually complete. Thus, this route is suitable when slow and continuous absorption is required. As with the insulin or allergy shots, intramuscular IM route. Since large muscles are well supplied with blood vessels, drugs in aqueous solution are rapidly absorbed and produce a fairly fast onset of action. However, for IM injection, medically trained personnel are required, while CSC injection can be done by the patient. Subcutaneous injection, subcutaneous, intramuscular. There are few blood vessels in the fatty tissue or subcutaneous below the dermis. Subcutaneous. Intravenous route, the third, or injection while medically trained intramuscular injection, medically trained person are required, while CS injection can be done by the patient. Intravenous route, IV. Through this route, drugs are injected directly into the vein and therefore directly into the systemic circulation. This method produces a very fast onset of action, and the therapeutic effect can be seen immediately. On the other hand, toxicity can be caused when high concentrations of the drug are delivered too rapidly. Consequently, the rate of infusion should be carefully controlled. Inhalation. A drug inhaled through the nose or mouth are particularly effective for patients with respiratory problems such as asthma, as the drug are delivered directly to the site of action. Systemic side effects are minimized. In addition, since the drug does those necessary to produce the desired effect is much smaller than that for the oral route, side effects can be reduced even further. Topical drugs are applied directly to the skin or mucous membranes of the eye, ear, nose, or mouth. This method is employed when the local effect of the drug is desired. Alright.
Unit 2. Routes of Drug Administration. Reading. For a pharmaceutical agent to be effective in carrying out its selective action, the drug must be administered in an appropriate manner. Each route of drug administration has specific purposes, advantages, and disadvantages.
Disadvantages.
1. Oral route.
Advantages.
With this method, drugs formulated in liquid or solid form are absorbed into the body from the gastrointestinal tract, GIT. This is the most commonly used route. Oral drugs are convenient, portable, painless, easy to take. Also, administration can be carried out by the patient him or herself. However, the onset of the drug's effect is relatively slow. 2. Sublingual route. In this case, the drug, usually in tablet form, is placed under the tongue. This produces a very fast onset of drug action because of the good blood supply to the area, but the duration of the drug's effect is usually short. 3. Rectal route. This method can be used for patients who are unable to take drugs orally or with younger children, elderly, or mentally disturbed patients. This route is useful when a drug is known to cause GIT irritation. However, absorption is often incomplete and effectiveness is unpredictable. 4. Injection routes. 1. Subcutaneous SC route. There are few blood vessels in the fatty tissue just below the dermis, so absorption is slow but usually complete. Thus, this route is suitable when slow and continuous absorption is required, as with insulin or allergy shots. 2. Intramuscular IM route. Since large muscles are well supplied with blood vessels, drugs in aqueous solution are rapidly absorbed and produce a fairly fast onset of action. However, for IM injection, medically trained personnel are required, while SC injection can be done by the patient. 3. Intravenous IV route. Through this route, drugs are injected directly into the vein and therefore directly into the systemic circulation. This method produces a very fast onset of action, and the therapeutic effect can be seen immediately. On the other hand, toxicity can be caused when high concentrations of the drug are delivered too rapidly. Consequently, the rate of infusion should be carefully controlled. 5. Inhalation. Drugs inhaled through the nose or mouth are particularly effective for patients with respiratory problems such as asthma. As the drugs are delivered directly to the site of action, systemic side effects are minimized. In addition, since the drug dose necessary to produce the desired effect is much smaller than that for the oral route, side effects can be reduced even further. 6. Topical route. Topical drugs are applied directly to the skin or mucous membranes of the eye, ear, nose, or mouth. This method is employed when a local effect of the drug is desired.
2. Listening comprehension. 1. Question response. Listen to the questions and possible responses. Choose
Drug development and approval. A way of doing something that has been used for a long time and is considered a standard, a conventional method. Drug development and approval. Compound. Something that consists of a combination of two or more parts, qualities, etc. Promising, showing signs of being successful in the future. Showing signs of being successful in the future. Prescribe, to authorize a particular drug or treatment for a patient, usually by a physician in writing. Prescribe, to authorize a particular drug or treatment for a patient, usually by a physician in writing. Trial, a process of testing to find out whether something works effectively and is safe. Conventional method, a way of doing something that has been used for a long time and it is considered the standard. For example, how much do you know about clinical trials? For example, do you know how it takes for a new drug to be approved? Also, new compound is a laboratory. During preclinical testing, a pharmaceutical company conducts laboratory and animal studies to test the effectiveness of the compound against the targeted disease. The safety of the new compound studies the physical and chemical characteristics new drug substance. The company in the application with the use food and drug. とか。寸法の脈、鎮にして弱。鎮はすなわち骨を司り、弱はすなわち筋を司る。鎮はすなわち仁となし、弱はすなわち官となす。官位で水中に入り、もし水心を破れば、歴節王冠伊豆。これに列節という。小陰脈。小陰の脈、負にして弱。弱はすなわち血不足。脈はすなわち風となす。風、血、愛迫り。すなわち頭痛引くがごとし。 性人脈清少縮小っていうの。短期しおのずから簡易で、礼節、屈伸すべからず、これ皆飲酒して、缶入れて、風に当たるのいたすところなり。味3なればすなわち金を破る。味3なればすなわち金を破る。金破るればすなわち金なり。金破れればすなわち金なり。名付けて節という。金なればすなわち骨を破る。金なればすなわち骨を破る。骨破るればすなわち牢なり。骨破れればすなわち牢なり。名付けて子という。子節愛狭まり名付けて断節という。節という。永気通ぜざれば一人巡らずともに美三生魚するところなく士族断絶し神経一人足主大気王冠位で血霊例えば発熱するはすなわち 歴節となすなり。巡らすことができない。そして